Welcome to today's class. Today we will discuss about examination of precordium proper. Many a time in examination and post-graduation examination, there is a short case examination with examination of precordium. So now we will discuss about examination of precordium. Here the simple steps like inspection, palpation, percussion, auscultation. We know these 4 steps, but in examination of the precordium, there will be inspection and later on there will be palpation and there will be no percussion and then there will be auscultation. So now we are going to examine for inspection of the precordium. So now inspection of the precordium. You know what is precordium? Precordium is the anterior chest wall overlying the heart. So there is no definite extension of precordium. In examination of the precordium, there are some points to look into here. That is there is any scar mark. You have to go through the textbooks for scar marks importance. Like there is a left under the mammary scar. Then there is a midline scar. What does this indicate? You have to read the textbook. I will not discuss more in detail. If there is any visible pulsation or not, and there is a visible pulsation of whole precordium, hyperdynamic precordium, these are the variations for examination of the precordium. Now we will go for palpation. You have to note it very carefully, the examination of precordium palpation. At first we have to locate the apex beat and feel the character of the apex beat. So we have to place our fingers below the nipple and try to locate the apex beat. So we have to locate the apex beat, and now we are feeling that where is the pulsating apex here, and if it is not definite, then we will ask the patient to roll on the left side. It is roll on left side. Now you can feel it more better and locate it and then turn the patient in previous position. Okay. Now you have to locate it, the position of the apex beat, and also feel the character. Is it tapping? Is it heaving? Or is it hyperdynamic? So now count the position, like this is the second intercostal space, third, fourth, fifth, and the normal position of the apex beat is in left fifth intercostal space, just medial to the mid-clavicular line, and describe it as like it is. And then you go for left parasternal lift. You can do it on left parasternal region by doing this heel of the palm or lateral side of the palm and feel if there is any sign of right ventricular hypertrophy, that is left parasternal lift. Then you go for palpable P2 in second intercostal space with 2 fingers. That is the sign of pulmonary hypertension. And this is all about the palpation of precordium. So we are doing at first precordium, feel for apex beat, then going for left parasternal lift, and then going for palpable P2. And also there is a point that if you can feel any thrill on the chest, the feel like a vibrating mobile phone or a tail of a purring cat, that thrill is present in some conditions like ventricular septal defect or aortic regurgitation, that is feeling of the vibrating, the defective cusp of the valve or the hyperdynamic circulation of defective septal defect. Now you are going to do the auscultation of the chest. Now for auscultation of the heart, we have to auscultate the 4 areas. I have shown the 4 areas. You have to check your stethoscope first and use the diaphragm of the stethoscope. First area, second area, third area, fourth area. And don't forget to put your thumb on the carotid to coincide, to identify the 2 heart sounds. The pulse of carotid which coincides with the heart sound, that is the first heart sound, and that doesn't coincide, that is the second heart sound. Like you have to do like this, one area, then second area, third area, fourth area. These are the process of auscultation of 4 areas. Then you have to do some extra maneuvers. Some examiners tell that you have to, if you suspect for mitral stenosis or regurgitation, then you have to roll the patient to left side and do maneuver for aortic regurgitation and aortic stenosis. But I recommend, and some authors recommend, that you have to do the maneuvers in exam setting, all the maneuvers. Like at first you have to, after examining the 4 positions, then you have to roll the patient left side and use your bell of the stethoscope in the apical area and ask the patient to breathe out and hold the breath. Breathe out and hold the breath. And then take the patient again on his normal position and then ask him to sit. একটু বসে যাও, হ্যাঁ, আর সামনের দিকে একটু ঝুঁকে যাও. Ask him to lean forward and then put the stethoscope on the left parasternal region, upper and lower side, only upper and lower side, to auscultate for presence of aortic regurgitation. Ask the patient to breathe, hold and stop the breath in expiration and also the aortic area, and if there is any systolic murmur, then also auscultate the aortic area, carotid area, for presence of carotid bruit, that is the transmitted systolic murmur for that. So these are the examinations for examination of the precordium. But last but not the least, if there are any heart failure. So if you have to examine the base of the heart, like please sit, and then you have to auscultate the base of the heart, like inhale, inspiration. Ask him to breathe in and out, and examination of the precordium is finished here. And also, now I will discuss about the examination of peripheral pulses. We have already discussed about examination of the radial pulse, and then I will discuss about other pulses. The next pulse is, after examination of the radial pulse, the next pulse is examination of the brachial pulse. This is not so easy. You have to practice more and more. A cup of the hand, do a cupping of the hand and put your thumb on the brachial artery and feel it, and then again on this side, brachial artery. Same, just changing the hand position. And then examine the carotid artery like this, and again on left side, carotid artery. Also examine for femoral artery. Femoral artery, you have to expose more the patient with just undergarments of this patient and put the finger in anterosuperior iliac spine to pubic symphysis joining area and above the position, 2 centimeter above, and you have to feel it. And also you have to do the radiofemoral delay examination here. You have to do it in other patients, in your real patients, by exposing enough for examination of the femoral pulses and examination of the radiofemoral delay. And then you have to examine the popliteal pulses. For popliteal pulses, you have to roll back, you have to flex the knee and put your fingers on popliteal fossa, both hands fingers on popliteal fossa and feel it. The surface marking, you have to read it from textbook, and then examine the arteria dorsalis pedis, apex of the first intermetadorsalis space here, and on both sides here, arteria dorsalis pedis. And also some authors recommend to examine for posterior tibial artery, just medial and below and behind the medial malleolus. This is the left and right posterior tibial artery. And after examination of peripheral artery, almost your systemic examination of cardiovascular system is finished. Thank you.